think this is fine. Thank you for the introduction, and thank you for having me here as well. So I'll just give a brief background about the study. So essentially the background to our study is we have a lot of older people currently living with co-occurring physical and mental health conditions, but very few service models are actually available providing comprehensive physical input to older adults in secondary mental health settings. So currently we have a bit of a challenge where mental and physical health are quite siloed. So we have separate hospital trusts, for example, where I work in Leicester. I'm based at Leicester Royal Infirmary, so that deals with physical health care, and then Leicester Partnership Trust, where the mental health wards are, that deals with all the mental health care. So it means there's a very separate management and IT systems, and no sharing of information across these organisations, and this creates a lot of challenges, and it really disrupts the patient's continuity of care, which is already a big issue, and it's something we really want to avoid, particularly for mental health patients as well. So little information is also available regarding these specific physical health care needs for older people receiving mental health care. So the aim of the IMPRESS Care study is to determine the facilitators and barriers to delivering physical health care for older adults, patients, their carers and staff within specialist mental health settings. So today I'm going to talk about the qualitative interview aspect of our work and share a few findings on these as well. So what did we do? We completed 54 semi-structured interviews, and these interviews were conducted in 2 different hospital trusts. So we conducted these within Leicester Partnership Trust and Nottingham Healthcare Foundation Trust. We also did interview people within the community as well, which is where Age UK, Leicestershire and Rutland came in, because they made some very good contacts with community organisations. Within these interviews, we explored the facilitators and barriers to delivering physical health care for older people aged 65 and over. And then we thematically analysed this interview data guided by the SELFIE framework, which you can see on the right here. So this framework encompasses 6 broad domains, and the central concept is understanding the individual's health, well-being, capabilities and self-management, and the individual with their multimorbidity is at the core. So we coded our interviews in relation to this framework. And then the themes that arose from our interviews, which I'm going to show you in a second, were in relation to parts of this framework which really stood out the most within our interviews. So what did we find? We also do have an array of quotes as well, and they are published. Well, our paper's just been published, so which I'll include at the end. So you can, many of these quotes are included in the paper. So if you would like to have more of a read, then that's included there. But we found 4 major themes with some sub-themes as well. Hopefully you can see all of them. I'm not sure if the writing's small. And these were derived from the SELFIE framework, and they're summarised in this diagram. So we still had individual with more multimorbidity at the core, but then we did combine some dimensions in relation to what came out of our interviews. So our second theme was to do with service delivery and workforce. We also had a theme relating to leadership and resources, and then a theme relating to technologies, medicines, information and organisational barriers. So what did we conclude? We found in general that within the patients on the mental health wards, there were very high levels of physical health comorbidity. A lot of the patients had complex diseases as well, and there were high rates of polypharmacy as well across inpatient and community mental health settings. So we also concluded that integrated services need dedicated funding and commissioning pathways, and senior physical health support is very important for this, alongside training and education for mental health staff. Services do need to be embedded in the MDT, and person-centred care needs to be prioritised. We also found that geriatricians have a very central role to play, but creative approaches are needed to orchestrate this in very resource-constrained settings. What are the next steps for the project? So I'm not involved in the quantitative aspect, but this is currently happening at the minute. So we're currently analysing some NHS digital data. We hope to integrate this data with the results from our qualitative study, and hold some workshops within co-design to produce service recommendations. My PhD also was derived from this study as well, as physical activity came out as a predominant need for the patients on the mental health wards. So I'm in my second year of that currently, and for my PhD I'll be doing some interviews, co-design workshops and acceptability testing. Within my PhD as well, I've also been analysing some care home data because many of the inpatients move to care homes from the Unpicked project, and I believe that's also for Venture funded, so I've been doing that with Dr. Jenny Burton as well. So yes, this is our paper that's recently been published in Age and Ageing. If you'd like to have a greater look at it, then you're welcome to, and I just want to acknowledge everybody on here as well for all their help and support within my development as well. So thank you.
Thank you very much, Bethan. Thank you. Any questions? Oh, we have one right at the back. While we're waiting for the microphone to get there, I'm going to go off script a bit.
Yes.
So PhD.
Yes.
Research assistant.
Yeah.
And also at a community organisation.
Yeah.
Yeah. Tell us how that is.
Yeah. So I think it's really nice because I get an insight into lots of different areas. So I know particularly I did a year at Age UK, Leicestershire and Rutland, and I hadn't worked before within a community organisation. And I think they were quite excited to bring research in as well. So I think we helped each other. And it really actually got me out into the community and talking to more people about the actual issue and the challenges within this work. So that was really helpful. And then I think I managed to bring those skills into my PhD as well, just by spending time with the actual service users. And yeah, so I can implement this into real life, really. Yeah. No,
that's brilliant. And so, obviously that goes, and it's nice to hear because obviously when we put funding calls together, we have an idea of what we hope to sort of achieve, and yes. you're the embodiment of that. So yeah. It's really nice. So another question just there.
Hi, Bethan. Thank you for the presentation. I just wanted to know whether you had or faced any challenges regarding patient recruitment.
Yes, we did. So I think if I actually go back to the if I actually go back to the method slide, we actually only managed to recruit 7 patients. It was a real challenge. Purely, I think, just because of a lot of them lacked capacity, and we could have gone. We tended to go through their carers instead. We could have gone to dual interviews, but the patients still didn't actually want to do the interviews anyway. So I think although we did really struggle with patient recruitment, we got the information through their carers as much as we could. However, we are currently working with our PPIE group to understand how we can better recruit patients and make more accommodations for them.
Yeah, thank you very much. Any other questions? Okay, a round of applause for that.